Hi. I have an appointment for 9:15.
Well, it depends. Usually most women after the surgery.
Okay. I'm just going to give you some papers to start filling out.
Okay.
Although it's not your period, you do with the medical procedure.
And when you're finished with these, just bring them up to the front.
Okay.
Oops. There'll be a nurse calling you through the door over here in just a few minutes, probably, or just a little bit, to do an ultrasound.
Okay.
But with the paperwork, just bring it to us. So.
Okay, thank you.
There you go.
Thank you. And can I use the restroom? Okay.
Fine.
Maybe I'll use it first and then I'll...
Sure, yeah, you can sit.
I had a little drive, so...
Okay.
Thank you.
101.3 at FM. We play stuff we like, including songs you tell us to. Here's another song you chose on Ed FM.
Okay.
Thank you.
You're welcome. You got both sides on the blues.
Yes.
Medical history, great.
Yes.
Thanks.
Yeah, sure. There was a couple things that I was like wanted to be able to talk to someone about it, but it seemed like I'll have a chance to. So.
Oh, sure.
Okay.
Yeah, absolutely.
Okay. So now, what is the next? Just wait out here.
Yeah. So, a nurse will call you through this door next, and then we'll go from there.
Okay. Thank you. Okay. Thanks.
Romulus station. And what they like, we like.
question. I'm just waiting for the ultrasound, I guess. And I was just wondering, are there like doctors here today I'm going to be able to talk to after the ultrasound?
Oh yes, definitely.
Okay.
Well, you'll be speaking with the counselor after the ultrasound.
Okay.
If you would like to meet with our doctor today, her name is Dr. Stella.
Okay.
And we can probably arrange that.
That would be good.
Between
Yeah.
procedures, if you would like to meet with her.
Okay. Would you be able to arrange?
Yeah, I'll write a note on your chart, and I'll
Okay.
see. I'll write it on your sign sheet. Have you finished with your paperwork yet?
Yes, I'm all finished with
then
the
I'll write it
paperwork.
down.
Thank you.
Thank you so much.
Okay, thank you.
Yeah, so after the counselor, you can definitely meet with the doctor.
Okay, perfect.
But there are two different names on your paperwork. And
Oh, sorry.
Would like to know which one you would rather
Okay,
go by.
yeah.
And it needs to be on all your paperwork.
Okay, thank you. There we go. Perfect. Thanks.
Just making sure.
Thank you. Sometimes I go by my middle name, but this is my last name. Thank you.
Thank you.
Is everything else okay on there?
Yes.
Okay, thank you. Okay.
Go into this room.
Okay.
In here.
Oh, okay.
And you can sit here.
Okay.
My name is Rebecca.
Rebecca?
Rebecca.
Oh, Rebecca. Okay.
And your date of birth is 12588.
Mm-hmm.
Is this your first pregnancy?
Mm-hmm.
Are you allergic to any medications?
No.
How much do you weigh?
About 120.
And your height?
5'2".
And you did a pregnancy test at home?
Yeah.
Where are you coming from?
Santa Fe.
Oh, okay, okay. Okay, I'm gonna do an abdominal ultrasound, so just put your pants and underwear until here.
Oh,
Sit
okay.
up here and cover with this. Coming right
Oh,
back.
okay. Okay. Oh, excuse me.
Yes.
This is actually wrong name. Is wrong name. That's the middle name. No.
Oh my God. That's it?
Yeah, that's it. Yeah, you could cross that off. Wrong. Yeah.
And it was teal.
No, that's not it either.
Why the hell did they put those names? Let me look.
Thank you.
Thank you.
Thank you.
Thank you.
You want me to sit up on here?
Yeah, just put
Okay.
up your pen. You know what? Take off the jacket because I'm gonna be drawing blood.
Ooh,
And
okay.
I need you to take off the jacket.
Okay.
Okay. Ready back?
Okay.
Oh.
Okay.
Somebody here with you?
Yeah, my friend.
Good.
Yeah. Yeah, thanks. You busy today?
No.
No? Okay.
No.
Well, maybe that's good for me then.
We only have today second trimesters.
Oh, okay.
And we started on Monday because the doctor is leaving. So we don't have nothing on Friday. So it's unusual on Monday to start because we never do. It's like never happens. We start on Tuesdays.
Really?
So it's like
When does the doctor leave?
the doctor leaves on Thursday. I think Friday she has a convention to go.
Oh,
That's why we
gotcha.
do it this way.
Oh, so you have to make sure
Yes.
that you. What is second trimester?
15 weeks and up, and then we have third trimester too.
Oh, really?
Yes.
Oh, wow.
People they are the babies are sick.
Oh, okay.
So you were
So,
on. Okay.
so you've seen women like far along as me?
Oh yeah.
Oh,
More than
okay.
you.
Oh, okay. Okay. So it's like pretty common.
Yeah, we got the farthest in New Mexico.
Oh, okay. Oh, wow. Okay. Gotcha.
So the doctor's gonna come right now for to do another measurement. We do seconds all the time
Oh, the doctor's gonna come in actually?
and do another.
Oh, okay.
So yeah.
So is it like how big is it then?
You want weeks
Um,
or no?
I guess like I'm just trying to think like, yeah, what? Yeah, either
How
one.
many weeks did they tell you were?
Like over 20? Yeah. But I'm not really sure. So is it a baby? It is. So like what parts does it have?
Everything.
Oh, does it? I mean, I sometimes I can feel it like moving. That's why I thought, you know. What are you getting?
I'm getting a second one. It's another measurement. It's the femur.
Okay.
I try to get, and sometimes it's very hard.
Oh, really?
It's floating. Floating in water, and I'm like,
So it's
pay
moving.
attention to me.
Oh, so it's like
But
moving
I will get
around.
it. I will get it. That's for sure. I will.
Okay. Have you been doing this long time? Oh, okay. So you have like different techniques.
Yeah. It's just to match the one that I got, the
Yeah.
head, and it goes. The femur is 2 weeks less, 2 to 3 weeks less than what the head measures
Oh, for mine?
for everybody.
Oh, for everybody. Oh,
So
okay.
if I get 25, the femur is gonna be 23.
Okay, gotcha. Okay.
Interesting, huh?
Yeah. Just get a little bit nervous about it all, you know?
Okay.
Yeah, that's why I was saying how big it is, because you just get nervous thinking, like, if it's big, you know?
Yeah.
Make sure everything... Like, how will everything go for me?
Yes. Exactly. Okay, now I'm gonna call Dr. Sella.
Okay.
Dr. Sella, back up sono, please. Yeah, but it's nothing. We can still help you.
Okay.
And
You can.
so the
Okay.
sometimes then I'm like
Oh, okay.
posterior.
Okay. What is her name? Sella?
Dr. Sella.
Sella? Okay.
Yeah, Sella.
Oh, okay. Thanks.
And sometimes she's meeting another patient.
Oh, so I might have to wait a minute?
Yeah.
Oh, okay.
So let me see. Are you right-handed or left-handed?
Right-handed.
Okay, I'm going to draw a little bit of blood.
Oh, I
know,
hate this
everybody
part.
hates this.
Oh.
The whole morning I'm listening to this.
Oh, okay.
I know. And this is just to draw blood and to push medications. We start giving you medications starting from the first day.
Oh, man.
Somebody here with you?
Yeah, my friend is.
You just told me that.
Yeah, that's okay.
Pump it. Just go there. Yeah. Beautiful.
Oh, my goodness.
Yeah, great. Okay.
You make sure, like, I mean, I won't get, like, infection from this or anything, like, the needle.
Infection? This is sterile.
Okay.
Take a deep breath. The needle is coming out.
Okay.
And then you will have a little plastic inside. And it's like a little catheter. Okay. Now the needle is out.
It's inside me.
The plastic is. See that?
Oh. Okay.
And you won't feel no needles anymore.
Okay.
And open your fist. Totally. Yeah.
Okay. Oh, man. Oh, I just don't like needles.
No. And you want to have needles every day. Sorry.
Every day?
Every day. Okay.
Or is it just stay look like that, or?
Before you leave, we take it out.
Okay.
And then we'll put another one tomorrow to give you more medications.
Oh. What are the medications?
The medications is fentanyl and a muscle relaxer, which is Valium.
Fentanyl. Okay.
Okay, and let me tape it. We're done.
Okay.
This part.
And sorry, what is it for? What is
For
the
pain
for pain? Okay.
and muscle relaxer. Gonna make you like relax, tired, like you drink a little a margarita.
Okay. Does all of this, is it painful?
The third day is gonna be very uncomfortable.
The third day?
When you're gonna push, we're gonna help you. You're gonna push.
Oh, really?
But we give you a lot of medication. We help you. We with you the whole time. We don't. Okay.
Okay. Push like I have to like push out the baby? Really? Whew. Are you gonna be there with me?
I don't know. I do a lot of stuff, and sometimes I'm there, sometimes I don't.
Okay.
But, yes, I know.
Okay. Well, I mean, I'm just like, do I push so does it come out whole? Like, how does it come out when I push then?
Like having a baby.
Yeah, is it like that?
But it's dead. It's not. Today we're gonna put an injection.
Okay.
And that injection is to stop the fetus heart, and it works 30 minutes to 3 hours. Tomorrow we're gonna check. We do an ultrasound and check that worked, and it's 99% that it works. It's very rare that it fails.
Okay.
Okay.
I'm just taking it in. So if what do you do? What if it does fail though? What do you do?
We put another injection.
You put another injection.
And then you come back in the afternoon to check you to see that you. But let's don't think about that. Let's think positive. And it's rare, really. It's
really rare. Okay.
The doctors are very good doing that.
I'm not like rare person though, you know. Like it happened to me.
Do you work?
Not right now.
Do you have Medicaid? You don't have Medicaid?
But my friend is gonna help me. Okay, so it.
Waiting for the doctor.
Okay.
Do a second one.
Good. Okay. Can I ask you about this though? Like my concerns. Can I ask you?
You're gonna talk to your counselor.
Okay.
But you can ask.
Can I ask you? Okay. Because I'm just thinking. Can you tell me what, like, when it comes out? You said, and it's then what do I do with it then?
You don't do anything. We do the rest. Nothing. Nothing.
Okay.
Nothing. If you wanna know the sex, we can tell you that. If you don't wanna know nothing, absolutely nothing, you just walk away from here. You have an appointment. You can go to a doctor, or you can come to us for a checkup in 2 weeks.
Okay.
But if you don't want to know anything,
okay.
Okay.
Can you tell me like what procedure, what it's gonna be like?
It's gonna be uncomfortable.
Okay.
The third day, it's gonna be, you're gonna have because we're gonna give you the third day. We're just currently gonna come at 7 in the morning. We start giving you medication by mouth to soften your cervix. So you're gonna have labor pain more and more and more and more and more. Okay, and then you're gonna be in another room, and a counselor, a nurse is with you, and she's gonna help you. Okay, and you're gonna feel. You have children, by the way?
No.
Okay, that's why.
No.
Okay. So
it's all new to me.
Feeling is like you wanna poop.
Okay.
And when somebody tells me, I feel like pooping, I'm like, yes, that's what I want.
Oh, really?
Very near to finish. Yes, that is the feeling.
So I feel like I'm gonna.
And of course, having a baby is painful.
Yeah.
It is. I mean, a head is coming out. So you're gonna, day by day, we're gonna dilate your cervix.
Okay.
And that's why the doctor wants to know how far you are, so she can dilate as far as you are. Okay. And we're gonna put also dilators. Those dilators, they look like sticks.
Can I sit up a little bit, or should I? You want me to stay?
You can stay.
Okay, I'll stay. Okay. That's okay. Sorry. Okay, I know. Okay, so keep going. I'm sorry.
So we're gonna put dilators so the cervix can open slowly overnight. What they do, those dilators, they absorb the moisture in your body, the water, the moisture, so they go thick. And the next day we take them out and we'll put new ones. And then you dilate more. And then on the third day, we break up the water, take out the water, and then you go into a room, and then it's when you start laboring with that medication that we're giving you. And we're gonna give you an IV, and we push medications to there.
Okay.
Okay.
Thank you. So when I labor, I'm gonna labor it.
You wanna
come out.
You wanna feel like it's hurting, and it's not. It can take half a day.
Really? Does the doctor does he help at all?
Yes.
Or he does.
The doctor is a she.
She, sorry.
It's a she.
She.
Or one of the nurses, they are there inside that gurney room. We call it gurney.
Gurney. Okay. So she helped it to come out, help baby come out.
Oh yeah.
Okay.
You you just push and we take it out.
Thank you.
Okay.
So then what if come out and the shot didn't work? Then what do you do?
Well, it doesn't come out.
It doesn't come out?
Yeah. We need to be sure that the shot worked. And it will be tomorrow.
Okay.
Then we're gonna check that. We check right away. It's the first thing we do.
Okay.
Okay.
I'm just thinking
No.
worst case scenario, if it came out.
No.
Wow.
You mean alive?
Yeah, that's what
No.
I'm saying.
No. We have to check that.
Okay, because
We
then
don't
what would I
proceed.
then what would I
We don't
do?
proceed. We don't proceed
You d-
until we do a lot of ultrasounds with this. We have another one over there. It's the
Okay.
first thing we're gonna do tomorrow.
Oh, okay. Because what
Yeah.
do people do if that happened?
It won't happen. It doesn't happen here because we looking that it's
Okay.
done.
Okay.
Yeah.
Okay. I mean,
So
if
we're
it did,
gonna
I have to.
put injection
I have to do it. I have to
You feel movements?
a little bit.
You're gonna tell me tomorrow I didn't feel any movements.
Oh,
But then
really?
Still, Then we still check. I don't care what you tell me.
Really?
We're gonna check.
So am I gonna feel it like, as it's, like when it dies? I'm gonna feel
No.
feel
you're
it dying.
not gonna feel nothing.
I'm not gonna
Just
feel it
not
die.
gonna feel feelings and
I just-
movements anymore.
Oh, okay. Because I'm thinking that would be like
No,
if I could feel
no,
it, like
no.
yeah. Okay.
Nothing.
Okay. 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 And then I go home.
You go home and you come back.
I go home. I come back tomorrow, and then I get
Tomorrow's
that.
the
And then I
easiest
get the
because
shot.
Tomorrow we're just gonna check that
Okay.
everything went fine. That
Okay.
Everything worked. We put more dilators and then you go home.
Okay.
The third day you're gonna be at 7 here.
Okay.
In the morning, and then we put medication. No.
Oh,
first.
that you said. Yeah. Okay. Okay.
Yeah. And then we burst the water. And then you stay there, and then you're gonna have cramping, labor pain, cramping, and it's gonna take time. Sometimes it takes 3 doses to 4 until you're like, okay, I'm like in a lot of pain and very
Oh. Okay. What if that starts happening to me at home? What if I
You're gonna
have the baby at home?
You call at whatever time. Whatever time.
Call you
We're
whatever
gonna give you a
time?
prescription for oxycodone and for nausea. Today, starting today.
Okay. So if I start feeling like I'm gonna push at home tonight,
No, I don't think it's gonna happen.
Not
tonight.
go-
It can happen the second day at night. It can. But you
and
have
if I
to
feel
do
like I'm gonna
first.
do it,
So I hope that you take a little bit longer and wait until you get here. Yeah, but if you do, you're gonna have to call us.
Call you?
No matter what time. 1 in the
Anytime.
morning, 2 in the morning, you call. We tell you, come on in.
oh, so do I call 911?
No, you're gonna call here. You're
Okay.
not going to any clinic but here.
Okay.
No.
Okay.
No, because
Why not call 911?
Because they're not gonna see you.
They're not gonna see me.
No. They're gonna say, where are you having this? You have to call there. Here.
Really?
Here. This is
Okay.
here. 911 doesn't exist.
Really? What?
I mean, it exists, but-
Yeah. What do they do there then?
Well,
What? Like?
some people
What?
they are against that, and they're gonna say she's having an abortion, and we're not gonna touch her. She has to go where she started this, and we have to finish this, and we are wanna finish this. We don't want you to call 911. You're gonna call this number. We're gonna give you everything, people, everything.
Oh, okay.
We're gonna give you. Don't worry. We're gonna give you a number to call. We're gonna give you everything today and tomorrow, and
What?
but you call here.
I will call here. What do you
And
What do you
some
mean
service.
911? They might not fit. Like, what do you mean they might
Well, why
not?
are you gonna call 911?
Like, in middle of the night,
No.
it's closed.
No, it's not close.
No.
We
Okay.
are 24 hours. Somebody's on call for 24 hours.
Oh, okay. Okay.
It's not 911. It doesn't exist for.
Doesn't
this
exist. Doesn't exist.
This
Do
week
not call
doesn't
911.
exist.
Does not exist.
No.
Okay.
No,
Have you ever had people do that? Oh, good. Because it would just be like,
because they're gonna say, "What are you having?" Well, I'm in labor. Says, "Why are you in labor? Why
Why are you-
You know, I don't even know what they're gonna tell you because
they're just.
nobody calls there. They call here. And
Everybody
customer
knows
service
what-
is gonna answer you, and then you're gonna say, "I need to talk to the lady that is on call." And they're
Okay.
gonna call the lady. The answer service call the lady, and then we bring you here.
Because I don't want to go there, and then
But you.
they make me. Then they make me have labor and everything.
No, you wanna come here.
Okay.
And you say, "Well, the doctor is."
Okay. Thank you.
You're very welcome.
Dr. Sella.
Are. Uh-huh. So, what did you get? Did you go through it?
Yeah.
Uh-huh. Okay, where are you from?
Santa Fe.
Uh-huh. And who's here with you today? Are you nervous? Is that what you're doing like this?
Yeah.
Okay. Did you have an ultrasound at all?
No.
No, this is
I was telling that not to call 911 because she said, do I call 911
for...
for if whatever reason?
Yeah,
I
yeah.
said no.
Because I'm going to go home tonight, yeah.
I said 911 doesn't exist for this week.
Yes, not for, yeah.
Okay.
And we are here. Like I said, somebody's on call for 24 hours.
Yeah, what just happened? Yeah,
Oh,
okay.
good.
Do you have a place to stay the other night?
Yes.
Yeah, okay.
And you're going to be my doctor?
Well, there are two of us, two doctors.
Okay.
We go two for the price of one.
Okay.
It's me and Dr. Landau. She's great. She has no gray hair.
Oh, okay.
And we're working together.
Okay.
Yeah, she's wonderful. Is that what you
Okay.
got?
No. I need to release but I want this one.
Okay. So, weekend is at your 27 weeks.
Mm-hmm.
Oh, really?
Yep. So you're about a month, yeah, actually you're about a month off in how you thought
Oh, wow.
you were. Does that change how you feel about this?
I just didn't know I was that
Uh-huh.
far. I mean, is there a difference?
In terms of, it's a
like-
different procedure. You thought you were 23 weeks?
Yeah.
It is a different procedure. This we induce labor. So you will deliver a stillbirth.
I
you
prefer-
oh,
yeah.
you already talked about that.
Yeah.
Yeah, so you know that. Okay. Okay.
Okay. Okay.
And it may last longer. It may take, usually it's 3 days, but it may be even longer. It kind of depends on your body. Have you had a baby?
No.
Yes.
Okay, could you, like, am I going to get to talk to you before I start everything?
Oh my God, of course.
Okay.
You would never start something without
Okay.
talking to you. You'll
Okay.
talk to many people because you'll
Okay.
talk.
I know I was talking to her.
You'll
Like,
talk to
okay.
Rebecca.
Okay.
You'll talk to a counselor. You'll talk to me.
I'll talk
or
to you
Dr.
too.
Linda, one of us.
Okay. Okay. And that'll be today?
We will start today.
Okay.
Just measuring your belly.
Oh, okay. Just like, what is this? No, that's okay.
Okay. Okay. Do you need more towels to wipe that off?
Yeah, that'd be, yeah, maybe.
Here.
Okay, thank you. Can I sit up now?
Yes.
Okay.
Yes, thank you, Dr. I'll be seeing you in a little bit.
Okay, okay. Thanks, Rebecca.
It's gonna be more money.
Oh, okay.
So they're gonna tell you, I don't know in my mind, but
But they're gonna
we can
tell me
give you a
everything?
loan also.
Okay.
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 All right.
Okay. So you can go back outside on it.
Well, yeah, I'll have time to talk to my friend and everything. Okay.
And they're gonna call you, okay?
Thank you.
Okay, time to select one of NFM's carefully researched, focus group tested songs. Here we go. Tiny Mo. Just the music on the radio. No one's coming, no one's gone. It's up home. Just me and you with the lights down low. And we're slow dancing, swaying to the music. Slow dancing, just me and my girl. Slow dancing, swaying to the music. No one else in the whole wide world. Just you. And we just float together like slow. Shadows dancing all across the wall. Music playing so soft and slow. Left the world so far away and small. We're slow dancing, swaying to the music. Slow dancing, just me and my girl. Slow dancing, swaying to the music. No one else in the whole wide world.
This guy here, his great grandparents were from China. His grandparents were from Taiwan. And his parents were raised in the U.S. Long years ago. But not strong as the superstar back in the
Hi.
Just wanted to go over the results with you.
Yeah.
So that is.
Is there something wrong?
It's all of that means we were basing everything off of the last menstrual date, which sometimes, pregnancies go at different rates.
Yeah.
Sometimes they have their check at the last menstrual date,
Okay.
just by birth rates. So it does mean that the cost is more. It is a longer process, so we wouldn't want you to delay that until probably like Friday midday.
Oh, okay.
So Is that, first off, is that not something you'd be able to do? Is stay in town for those nights?
I think, how much more is it, do you know?
So the total cost would be $8,000, and that's what we can do is we can do a loan amount.
Okay, I still want to go, I still want to do it. So, can I just, I'll just, like, finish meeting with the counselor and the doctor and stuff.
Do you want to do that first?
Yeah, can I do that first? Yeah, and then maybe I'll have more information.
Yeah, definitely. Okay. So we'll do that, and then just after you've talked to him, everything like that, let us know. We can, you know, if you want to continue this week, we can. If you want to, like, do it for next week, that's
okay. That might be better. Okay.
So the fee does increase on that for next week.
Yeah.
It's something that we could work out.
That might be better. At least if I'm here, I would rather just get all the, just be able to figure out everything since I'm here already.
Yeah. Well, yeah. Well. Okay. So yeah. I'll get you set up to talk to someone, do all that part first.
Okay. Good. Yeah. I'll meet with the counselor and then I'll talk to the doctor about everything with the procedure and stuff.
And yeah, and the counselor will go over that too with you as to what the procedure is, what the risks are.
Okay.
Anything like that. So any questions?
Okay. Okay. Thank you.
All this good
Me? Or
Her.
huh?
My name's Susanna. I'm going to be your counselor. Go ahead and have a seat on the couch.
Oh, okay.
So we just set aside a little time to answer any questions or concerns.
Oh, okay.
And go over some more paperwork. Was there anything concerning or questions you had on any of the procedure?
I just feel like I want to like kind of talk to the doctor about everything.
Okay, and you'll have a chance to meet with the doctor.
Okay.
This is just in case I can answer anything for the doctor ahead of time, and then you'll definitely have your time with the doctor. So regarding like steps in the procedure, did they fully cover all of that, or
not? I mean, if you like it, I mean, have they done on people at my stage before?
Oh, definitely. And
this
further.
late? And, okay, so it's fairly like common. Okay.
Yeah.
I mean, if I guess like, is it? I mean, it's like pretty big. Do you know like how big?
So
it is? Like,
you're 27 weeks, and that's, let me see, finishing up about 6. You're in about 6 months into the pregnancy. So it is. It's probably maybe a pound. A little over a pound.
Oh, okay.
Okay.
So like, just like that, like
maybe. Let me think. It might be the size of like. I'm trying to think. Let me see if they measured. They can't measure the actual. The whole thing. I think they just do.
Oh, okay. Okay. Is it a baby?
Well, what do you consider a baby? It's definitely a fetus.
Okay.
As far as medical definition of a baby, I think is technically until it's born.
Okay.
And until then, when it's in gestation, it's considered a fetus. So it depends what the term baby means to you. And how you perceive it. Okay. What is your perception of it?
I guess I just wanted to know if, like how, like it has all its parts and stuff. I just am trying to think, like...
Yeah.
Okay.
Yeah, it does. It's developed, as far as, in terms of, surviving on its own.
Yeah, I guess that's kind of what I'm thinking.
It would have difficulty, but, and need assistance at this point. Okay, so, the last thing to develop on fetuses are, like, their lungs, really. So would probably have difficulty breathing and need assistance, like with the incubator. And,
what's that? Oh, okay.
So that it probably, if you were to have, say if you were to give birth or labor right now, it would have to probably spend some time in the hospital before you would take it home if you were to give a live birth.
Would they? Okay. Would that happen? Could that happen?
Today, no, that will not happen in this process. Okay, because the main point, because we would give a digoxin injection to the fetus, and that would lower the heart rate. Okay, so when you do on the 3rd or 4th day have the procedure and do past the pregnancy, its heart will have stopped. It will not be able to survive.
I won't be able to survive.
No, not at all.
Okay.
Yeah, once the heart stopped, nothing else continues to function.
Oh. Okay.
Yeah.
So I mean, it if it was like, what would happen if it was like moving or something when it came out?
Well, we would check that the injection worked, and by doing that, we would look for a heart rate. And we'll check that tomorrow. Okay. And there's no expectant it to be moving when it comes out. Okay. It'll already be deceased.
Oh, okay.
Yeah.
But if it was though, like, would I have to take it or?
No, not at all. But we wouldn't continue with until if the digoxin injection didn't work. Like I said, we would check and we would administer another. Okay, so there's no passing of the pregnancy without it working at this point. Yeah.
Okay. Yeah, because I'm thinking, I'm just thinking I wouldn't want to have to, like,
take it home.
Yeah.
No. And it would and that wouldn't be a possibility. Okay.
Because you hear rumors like that you have to, like, a failed procedure or something like that.
No, I've never heard of it or seen it, to tell you the truth. So don't worry. And this is definitely something you can talk to the doctor about.
Yeah. Okay. I will. Okay? Yeah.
Any of your concerns that you have with me, even though we go over them, I try to just cover what I can with you, just because the doctor's busy doing stuff. And you can definitely bring them up with her as well. Okay.
Oh, okay.
Doesn't mean that you're not allowed to.
Okay.
I also want to let you know that there's we'll probably schedule you in the morning to meet with some of the other patients. Okay, who are in the same gestation. Okay.
Oh, that would be nice.
Yeah, it's kind of nice. The doctor likes to do this so that you you kind of posed earlier. You felt like you're the only one. You're not. We do have other patients this week who are going through the same process as you. Okay.
Okay.
So that kind of helps. It's kind of for the doctor to, you guys kind of know each other and have a little support within the clinic during your stay.
Okay.
So yeah,
that would be nice.
And it's nice because you all may have similar concerns. So that kind of come up and
Yeah, that was definitely like something when we first started talking about it being later, like me being far along, you know, just thinking that it could like survive basically.
So no,
Yeah.
In this procedure, in our process, we make it so it does not. And then even if you were to be earlier, where say you were say in the first or early second trimester and the digoxin injection was not given, the sedation would affect the fetus. It would have it could cause fetal indications from the sedation, from the medicine we give you. So the chances of its survival isn't possible outside of the mother. Okay.
Oh, okay.
But because you are a little further along, there are very premature babies who, you know, women go into early labor.
Yeah.
But we don't. That's not a possibility because we do administer the digoxin.
Yeah. Exactly. And I mean, we wouldn't like. Would you try to like save it, and then I would have to keep it?
Well, see, I guess the way I understand it is we would check before it exiting your body for a heart rate, and if there is none, then there's nothing to do to save it. Yeah, there's no. Our concern is your safety. You're our patient, so yeah, in this situation, yeah, that's the safest way to go about it to stop its heart rate.
Okay. So, could you just tell me like a little, I guess just like how the procedure works, like I guess?
Sure.
Yeah.
So by day, today what we would do is the digoxin injection. So it takes a few hours to lower the baby's heart rate. You don't feel anything. It's directly administered straight to the pregnancy. Okay. And then it just
like through me.
It doesn't penetrate you. Okay, so we're gonna place a speculum, which opens your vagina. We're gonna slightly dilate your cervix a little bit, and then that makes kind of a gateway to get straight to the pregnancy. Okay, so it does. In terms of it's gonna go through kind of the birth canal and stuff, but it will not penetrate any of you yourself, just the pregnancy. Okay. And then we'll insert some dilators to begin dilating your cervix, okay? They're called laminaria, or they're also made out of seaweed, so we refer to them as seaweed sticks or dilators. Yeah. And they work kind of like a tampon where they absorb moisture and start opening up your cervix, okay? That could cause a little cramping, which will give you a prescription for oxycodone and also promethazine, anti-nausea medication, in case the oxycodone is too strong for your stomach. Some women can get nauseous. Okay, and you'll want to take that promethazine as soon as you have signs of nausea or vomiting. Okay, if you're prone to getting nauseous taking medicine, then you just go ahead and take them at the same time. Okay, we'll also give you ibuprofen if you feel the oxycodone's too strong, and some doxycycline, which is an antibiotic.
Excuse me.
To prevent infection. Okay, and all of this is written down, a lot of stuff, and it'll be re-explained after when you're in the recovery room. So every day we do give you the sedation in your arm through the catheter, and we give you fentanyl and Versed, so an anti-anxiety medication to kind of help you calm down or make you a little relaxed, and then the fentanyl is the pain blocker. So it blocks the receptors of pain to your brain. Now we do give in small doses because everyone has a different tolerance. So today I'll be in the room with you and the doctor as well. So I'm kind of your advocate. If anything's intolerable or overwhelming or anything, you're in charge. So if you need a break or anything, or you feel like you need more medicine, just talk to myself and the doctor, and we will most certainly help you. Okay. We just don't want to over-medicate if we don't have to, and that's why we start small.
Good.
Okay?
Good.
So that's what's going to happen today. Tomorrow we will take out the dilators and insert some more. So a short visit, okay? Kind of check how you slept, how you were doing, and how you're feeling, okay? And of course the doctor will check to see how much you've progressed, okay? And then our intention is Wednesday to remove the pregnancy, okay? You will have labor pains, you will have contractions, it will be work, okay? It'll be uncomfortable, so you'll want to bring your oxycodone and promethazine in case you need it, because we can't be giving you the sedation all day because it offsets labor progress. Yeah. So be sure to bring that prescription, and you'll want to anticipate being here all day. Now, we do prepare you that it could be a 4-day process if your cervix is not progressing. Pretty much the procedure and the removal of the pregnancy cannot be done unless your cervix is opening up, okay? So that's, we manipulate it a little bit chemically with some misoprostol, and we might induce contractions with a little Pitocin, but we can't force the cervix to open, okay? That's a safety concern, and that's our ultimate priority, your safety, okay? And so we just try to let it open as it needs to, and as much time as that needs to take, we're gonna allow it to take, okay? So we can't give you a time when it's gonna be done, an exact time. It's when it happens, okay? So there is a possibility, and I always like to warn all the patients that you may be sent home Wednesday if you're not progressing enough, and sometimes eating and sleeping really does a ton for the progression and just relaxing. We try to make you as comfortable as we can here in the recliners and gurney beds, but sometimes your mind is just not letting go, yeah, in this setting. So if you can go home and rest and then come back either the next day, or if you so happen to go into early labor over the night, then that's fine, okay? You will have to, that being said, you will have to stay here. Are you traveling back and forth to Santa Fe, or are you? No, we're gonna just stay somewhere close. Okay, perfect. Yes. Did you decide which hotel? My friend's setting it up actually, so. Oh, okay. She's kind of doing all that for me. And is it one relatively close? I think so. Okay, yeah, because we like to refer you to like the Plaza Inn, which is right across the street, or the MCM Elegante, because they have shuttles in case you need it. But yeah, we'll need to know which hotel, the hotel room. In the event that you go into early labor, a doctor and a nurse will go to you, okay? So, but if it's too late, they will go to you, okay? If you're still, like, maybe your contractions are on top of each other, right, you know, and you have time or you have someone to bring you, we'll ask you to come to the clinic, okay? Even if it's middle of the night. Okay, that's good. And well, yeah. If we can't catch it early enough, which it has happened, and I don't know if they've prepared you or mentioned it, that's why we take this time in the council to go over, okay? Then we'll give you instruction, you know, what to look out for, what to call us for. If you're feeling pressure, it's moving down or something coming out, the pregnancy coming out, then you'll want to unlock the door to the hotel room, get your cell phone, and just sit on the toilet. You don't have to look at anything, you don't have to clean anything up or nothing. Just be on the phone with us, and we'll and you could stay on the phone with us until the doctor and nurse get there. Okay? Oh, good. So just go in the toilet if I'm having labor. Okay. Yeah. And what if it does come out when I'm on the toilet? Just, you don't gotta look down. You don't gotta do anything. The doctor and nurse will come take care of it. They'll take care of it. Okay. Yeah. So what would they like do with it? Like we wrap it up and bring it back to the clinic so we can wrap it up and just. Okay. Yeah, and you don't have to look at anything. You don't need to do any of that. Okay. Yeah. You just need to communicate. Okay. And so long as someone's with you, they don't have to do anything either. Maybe just be there for support for you. Okay. And they don't have to look or do anything. Okay. I know I'm thinking it's in the toilet. Like, I mean, don't like just like flush it or something like that. Like. No. Just leave it all there. Just leave it. You just sit on the toilet and. Okay. Whatever feels comfortable. If you feel like if you feel an urge to push and it's more comfortable to push and get it past, go ahead. Okay?
Go ahead and push. Okay.
Yeah. If you feel like it's too much to see any of it, then do not let yourself look at it.
Okay.
Just
okay.
If you want to cover yourself, even with like a towel or something.
Okay.
Go ahead, and when we get there, we'll.
Okay, good. So just basically push it out and just.
That's in the event that you're already feeling it passing. Okay.
Okay.
If you can catch the signs and symptoms before, and that's only because there's some women who have contractions and they have the luxury of not feeling pain when they're in labor. Okay. Otherwise, most women know what's going on. Okay. So yeah, we'll try to catch it before, but I just want to prepare you. Worst case scenario.
Thank you.
Type thing.
Okay.
Yes.
Well. Okay. So worst case scenario, if it comes out in there, and I'm gonna call and everything.
Yeah.
If I look down, like the whole thing with it, like, I mean, am I gonna have to take it out? Like, what if it comes out and in the toilet and it looks like it's like breathing?
Unlikely.
Okay.
Probably not going to happen. Okay.
Okay. What should I do if it does? That does happen.
You know what we're going to do is I'm going to let the doctor know and the nurses know that we're going to confirm with you that that there is no heartbeat. Okay.
Okay.
And that's kind of to
just to
calm you down. So you
but either way, like it would, I wouldn't have to worry about that because it would be taken care of.
I would say.
Okay. Okay.
I'm gonna tell you for sure if this even happens.
Yeah.
You're just gonna the steps you're gonna take are and your friend.
Okay.
Or your friends with you or
with you? Yeah.
Okay. You guys are just gonna, if you're feeling it coming out. You're gonna go sit on the toilet with the cell phone.
Okay.
You're gonna start calling the on-call person. Your friend's gonna just go unlock the door so the doctor knows and they can just come straight in. We don't talk to the front desk. We don't do anything like that. We just come straight like we're guests to your room. Okay, so we don't cause a commotion or anything. They're just gonna come straight in calmly, and you're just gonna sit on the toilet with the towel and whatever. Okay, don't look down. Don't. Even if you're concerned, you're going to be on the phone with someone, and if you have any concerns like, oh, I feel like this is happening and I want to look, or I'm worried, they'll talk to you. Okay?
They'll tell me what to do. Yes. Okay, good.
They'll know exactly what to do, and you just stay there until the doctor and nurse get there. Okay. So no action from you other than to sit on the toilet and be on the phone.
Good. Okay. And I was talking to the nurse about this. Like, even if it's the middle of the night, like. I don't call 911 or anything.
No, you'll call us, okay? Because if you were to call 911 or an ambulance or anything, then it kind of make it a little complicated. But also, we're ready for this. We've done this before.
This has happened before.
There's just some women, they just progress, and it's not anything to be concerned about. Okay, it's not not the emergency situation like a live birth where we are worried about the fetal life. Okay, the life of the baby. Okay.
What's the difference with that?
Well, because
because
in a live birth, the baby's alive. Okay, so you're worried about the baby's condition as well. You will be delivering a stillborn, in a sense, okay? So we're not concerned about the baby's condition, we're just concerned about yours.
Okay, gotcha.
Yeah.
So we don't have to worry about the...
Yeah.
Okay.
It's not quite as emergent. It's still it's still an emergency in the sense of your well-being. That's why the nurse and doctor still go straight to you. But it's not in the sense, so if an ambulance were to go and it could be a little more traumatic in the sense, because if they were confused and didn't understand that this was an abortion process and they're trying to recover the fetus and there's nothing to recover. So we don't want you to go through that.
Oh, yeah. They would basically try to, they might try to take it out and, save it, you're saying?
Yeah, when it can't. It can't be.
Yeah.
Okay.
Yeah, like,
that would just cause
can it be at am I 26 or something? Can it survive at 26 weeks?
You know, it's in this process, it's not going to survive. There's no possibility. Okay, there's no possibility in recovering it. There's no chance in you delivering a live baby. Okay. It's going to be deceased. It's going to be stillborn. Okay. By the time we get to that point. Okay.
Gotcha.
Yeah.
Okay.
And we'll go ahead and we'll confirm it with you. Okay.
Gotcha. Because otherwise, there's a possibility, like if it hadn't if it had that care or something like that, then that might happen.
You mean it surviving?
Yeah, like if I wasn't calling you, then there might be a chance that they would like take me there and try to save it.
Yes.
To survive it.
I mean, I'm sure if you explained, maybe they wouldn't. But so pretty much what it's considered once it's out of your body is hazardous waste.
Okay.
Biological hazardous waste, okay? And it's disposed of as such unless you'd like otherwise. Okay.
Okay.
And that's something you'll go over with the doctor as well, okay? Okay.
Okay.
So that help a little bit and put into perspective the situation. Okay. Okay.
It does. Thanks.
Does that help?
Mm-hmm.
Okay.
Yeah.
I guess how do you feel hearing all this? Is it overwhelming or any?
I mean, it's a lot.
Yes, it's definitely a lot.
I might have to, because I thought I was earlier, so I might have to talk to my friend about the money and all of that issues. Okay. But I mean, it's not in terms of like changing. It's just in terms of making sure with the money and things like that. So, but they said I have a little bit of time.
Yes.
So that's okay.
So, yeah, you do have, if you did need to reschedule for next week or anything, then that's totally fine.
Okay.
The price may change again next week. It does go up every week. If you need a day, I could talk to them and just double check. You still may be able to come back tomorrow and start.
Okay.
So that maybe there's not such a price, but that's not definite.
Okay.
Okay. I would say plan on possibly having to reschedule for next week and the price going up even more.
Yeah. Okay.
Do you need that time?
I think so. But maybe I just wanted to talk to you and like talk to the doctor and things like that, and then I'll talk to my friend and stuff. So
let's go ahead and do that, and we'll get the counsel and everything out of the way, and so you know exactly what you're dealing with, the process, and if you need that might also help if you need time to process that as well.
Okay, yeah, and you said I'll be meeting with other women and stuff too, so that's good.
Yeah, you'll meet the other doctors. If you want to meet with them, you'll meet with them before we begin, or today. It sounds like it might benefit if you meet with them today. In the event that they're busy or don't have time today, we may have to put that off until when we reschedule you. Okay?
Okay.
So, and I'm not sure. I need to check when we come out of the room, okay?
Okay. So are you going to be in the room with me then?
During the laminary and everything, yes. Every day you will have, once you're in the procedure room, you will have a counselor with you every day.
Oh, okay.
So yeah, you're never just by yourself. And that's because we know your situation. We're there to be your advocate and totally focus on you and your and kind of relay that to the doctor. Okay, so you know the doctor is taking care of you as well, but she's focused on her thing, and then we kind of assess and communicate with you to the doctor during the procedure if need be. Okay.
Okay, so like the shot part you were talking about, that it goes like up.
Yeah, like it goes through your vagina, past your cervix.
Okay.
Not through, but past your. Yeah. So I'm gonna show you this little diagram. See how there's kind of a canal, and it's the birth canal. So you know how, I mean, unless it's a C-section, you're not being, it's not penetrating the cervix or the the actual tissue. The uterus is a muscle, the vagina is a muscle, the cervix is, they're all muscles, okay? They're all opening up.
You're good at explaining stuff. Okay.
Yeah. So we're not penetrating any of that to insert the injection. It's going straight into the sac and to the pregnancy, okay?
Oh, okay.
So
so it's
yeah.
going like in the it's going in the baby, really.
Mm-hmm. Yes. Yes.
Okay. So where does it go? Like, does it go in the head? Like,
it
where
does
it stick?
It depends the positioning of the pregnancy. Okay. So if it is a breech in the bottom, it's bottom down, it'll insert through the baby's bottom. Okay.
Okay.
If
So
it's the head down, it'll be inserted through the head, through the cranium.
Oh, okay.
Yeah, but
Yeah,
not actually penetrating your tissue.
Okay.
Yes.
Does it feel that?
You know, I'm not sure. That'd be a good. I don't believe so. I don't know if it's developed enough to feel that.
Okay.
It might be. Okay. Does that idea bother you? If it does feel it?
A little bit, I guess. Like, I mean, what about you? Like,
well, I feel that it's necessary for the procedure to happen and ultimately safest and kind of the most kind of humane way to do it, you know, because we cannot deliver a live baby. That's not the abortion process, you know.
Yeah.
This is kind of the process to ensure your safety and ensure that it is
it's safer, yeah.
deceased before it exits your body.
Has that ever happened?
No.
No. Okay.
That's why I'm
because
saying.
that's why you're saying it's safe. Okay, so there's not been like
we confirm
safety
tomorrow
things.
that the heartbeat has stopped. If it has not, we administer another injection.
Okay. Oh God, that's okay. Because that's what I was gonna say. If it missed or something, and you said,
yeah, that's why. And every day, I guess maybe this helps kind of piece it together. Every day, the procedure is guided by ultrasound. It's not the best ultrasound like at a perinatal, where they can check everything and see everything very clearly. It's just enough to do basic measurements and see cardiac motion. Okay, so the heartbeat. Okay.
Okay.
So what we always do with the relaminaria insertion when we take them out tomorrow and place more to continue the dilation is we always check for the cardiac movement, and that confirms if the injection worked.
Okay.
So maybe that would. I'm sorry. I should have pieced it together in that sense. That's where the confusion was, and that does the confirmation. Okay. So we will most definitely let you know, because that's like a concern for you.
Thanks. Okay. And does it always come out like in one piece then? Normally, like.
There's two. If you were a little earlier on, the procedure would be considered a D&E, a delivery and extraction. That's where the doctor assists. Okay, and that does not always. That does not come out. It comes out in pieces. Okay. The safest way and to go about it is, and not that the D&E is any more dangerous or at risk for your safety. It's not. Absolutely not. But the easiest way to kind of go about it is sort of a labor process, and for you to dilate. And if you feel the need to push, and that's the way it comes out in entirety.
Okay, so it's like having a baby, but a dead baby. Yeah. Okay. Stillborn. Oh, that's what is stillborn.
Stillborn is a dead baby. No cardiac motion. No, it's
okay.
It's that's the term they use. Stillborn.
Okay.
It's dead.
Okay. Is it the same as a normal labor?
It's very similar. Normal labor, like I say, they're concerned with the live birth, a live baby coming out. So they're concerned about the condition that the baby's in. So a lot of times when you hear a regular pregnancy, if your water breaks, there is a time limit that they're concerned with, and that's because of the baby's condition. Okay, we're not so worried. We're not worried at all about the baby's condition. Okay, because this is an abortion. We're only concerned about your condition.
Okay.
So those kinds of details, those kinds of concerns are eliminated. Okay. So if your water were to break, you would just call us and let us know. And the rush to get here is not immediate, like it would be if you were delivering a live.
Gotcha. Because we're not worried about the rush of the water. Because we're not worried about the babies or the.
Yeah.
God. Okay.
So that's why it helps to go over this and explain. If a dilator falls out, it's not a huge. You just call us and let us know, but it's not an immediate concern. What we're worried about is if you're contracting very close together, you have no relief between contractions.
Oh yeah.
Also, if you feel like pressure's moving down, it kind of feels like you may need to poop or push or something.
Okay.
Give us a call. The only critical immediate concern is if, worst case scenario, you're sitting on the toilet and it's coming out. Okay, and that's when the doctor and nurse go straight to you. Otherwise, if we can get you here when you're getting those real close contractions, or when you're feeling, the pressure moving down, if we can get you here before the actual delivery, then that's ideal. Okay, and that's what we plan. So. Ideal scenario is, and typical, what usually happens, we just prepare you for worst case scenario. We want to prepare you for everything so you understand and you're not shocked or traumatized, okay? Is that you come in Wednesday, we start you on the misoprostol, which helps soften your cervix and starts some contractions of the uterus, okay? And then we monitor you here the whole time so that you're here from the time you're in you're a little more dilated, but we kind of try to finish the dilation and then the delivery happens, okay? And it all happens here.
Okay.
But like I say, if your cervix is not open enough and the progression is just at a standstill, then you'll benefit more from going home and resting and eating and getting kind of out of this environment for a little so your body can do what it needs to do. And that's the only worry point that we're always on call, we're always aware of, we always consider, and that's where we need you to stay by our phone. Okay, and we'll go straight over to you.
Okay.
Yeah.
Okay.
So
gotcha.
Yeah, and like I say, it has happened. They know how to deal with it, how to go and take care of you.
Because it has happened.
Yeah, you just need to stay on the phone if you feel it is happening, on the toilet, and then they'll kind of walk you through.
Okay.
Like, do checks, see how you're feeling, see what exactly is happening, and give you instruction whether to stay put, sit on the toilet, it's coming out, or come into the clinic, get you into the clinic. If you all, do you all have a car?
She does.
Okay. So we'd ask for your friend to drive you here to the clinic, and then we would finish it, okay? Finish the process.
Okay, gotcha.
Okay.
Okay.
Does all that help?
Yes.
Yeah, so see, that's why
I just thought, what if my phone dies?
Well, there's hopefully a phone in the room, and got your friend's with you. She can bring it to you or be on the phone if you're sitting on the toilet.
Yeah. Okay. And that's why you have to make sure, because I'm thinking, what if the woman was by herself? What would she do?
And you're going to meet with them tomorrow, but they're the woman who's here by herself.
Really?
So we go over all that with her. We go step by step. What would you do in that situation?
Yeah.
Have you considered that? That's why we ask when you're making the appointment if you will be accompanied by someone or not, and we try to consider all these things ahead of time before.
Yeah. Is she gonna have somebody? Is she gonna be able to get somebody?
No, but she's prepared and she's considered everything, and she does have a cell phone. Hopefully she charges it.
Yeah.
If not, she may just have to grab the phone and try to pull the cord to the toilet.
Yeah, just try to pull it and get it close to the toilet. Okay.
Yeah. So we definitely go over all these things, and this is why it's good to have this time.
Thank you. I'm sorry, what was your name?
Susanna.
Susanna.
Yeah.
Okay. Okay. Thank you, Susanna.
You're welcome. And anytime you need it repeated or clarification or any kind of questions, just call us.
Okay.
So we totally understand it could be an overwhelming experience. We're trying as much as we can to explain what we can, so it's not traumatic or it's not something you carry as a bad experience when you leave here. We understand it's not an ideal situation. Yeah. So we just try to get you through it and help with what we can. Okay. So,
have you ever been through it before?
Not advanced
okay.
abortion, but I have had early abortions.
Oh, you have? Okay. Okay.
Yeah. So, it's much different. There could be similar feelings with early as advanced, or there could be completely different experience. Okay.
Yeah, because I've never had early, so
as far as physical, it will be a different experience, but as far as emotional, there could be a lot of very similar, and that's also the benefit of the meeting in the morning, that you're with other women who are close to gestation as you guys are close together, so you may be feeling more similar things. Some emotions or concerns might come out that other women are afraid to express or open up about, but everyone kind of benefits, and gets a little bit more calm.
Yeah.
to get through it.
Yeah.
Just knowing that there's other
women. And are they gonna have to go through the same process as me?
Yeah. If they're all advanced, yes.
Okay.
Now, I just need to double check that everyone will be in attendance with the meeting. If there's some patients who the doctor feels will benefit or will not benefit.
That's fine. Yeah, I was just wondering. Yeah, no, that's fine. Yeah.
I really think it would help.
That's fine. Yeah.
If you attended. So I kind of give my recommendation to the doctor, and then of course she meets with you and assesses.
Oh, well. Thank you, Suzanne. Okay. Sure. So if I could I talk to the doctor today?
Oh, you will definitely meet with the doctor.
Okay. Okay.
At some point, if you are very adamant, it would just help you.
I think it would just help me. It would.
Yeah. If you met before you left.
Yeah.
The only thing that would stop that is if we just are backed up or anything. Okay.
Gotcha.
I've no clue yet because I've been.
Well, I can wait in here if you want. Or
yeah, you would probably meet in here if you need to reschedule. So is that a definite that we need to reschedule you?
I think so. Yeah.
Okay. So yeah, you'll.
But the only problem is, do I have to keep this in?
No, we'll take that out.
Okay. Okay.
Okay. So as far as let's back up a little bit. When did you find out you were pregnant?
I don't remember. Like maybe. I can't remember actually.
Weeks ago or days ago or
no, more than days ago.
Okay.
Yeah. Like weeks ago.
Like December or November?
Yeah, more before December.
Okay.
Yeah. Yeah.
And do you remember like your initial reaction when you found out?
Well, I was with somebody and I'm not anymore, so.
Okay.
Yeah.
So when you found out, was it did you have intentions of keeping it?
Well, I told him about it, and I mean, we were going to decide together, so that's kind of why I waited, and then now he doesn't want to, so.
Okay.
So I don't want to either.
Yeah. And that was kind of the defining decision.
Yeah.
Okay. Does he know that you are here today?
He knows that I'm going through with it, yeah.
Oh, okay. And does that...
I'm not really with him anymore,
yeah,
so...
but does that...
Yeah. I'm...
Hi.
I'm sorry, I keep going into the wrong room.
That's okay. It's actually Dr. Stella. You'll meet with her, yeah.
Okay.
Does it influence your decision, being with him or not being with him? Or do you, if there's any anticipation you all would get back together, do you feel like there would be regret in your decision?
I mean, I haven't really thought about those things because I kind of...
Yeah.
I'm not planning on getting back together with him.
Okay. Okay.
That would kind of lead to just...
Yeah. Do you mind me asking,
regret.
like, what led to the pregnancy a cause for the breakup, or not?
Yeah, kind of a whole bunch of different things.
Okay.
Yeah.
Okay.
But it might have been part of it.
Oh, okay.
With him.
Mm-hmm.
But I've talked to about this too, and it's just... I just don't want to... Yeah, exactly.
Yeah, wrong time.
Yeah.
Okay.
Especially without, like, with being alone.
Mm-hmm.
I mean, I have other friends and stuff, but just, like, alone, like I would just want, like, a father.
Mm-hmm. Yeah. Yeah. Not the ideal situation. Yeah. And how are you doing with that? Does that idea bother you, or?
No, I mean, I just wouldn't want, like, baby to not have parents.
Right. Very normal.
Yeah. I mean, I know, like, single moms can be okay, but...
Yeah.
So...
Well, but it's your life. It's your decision. That's most important, you know? Had you considered adoption or any other alternatives? Have you thought about it?
It would just be hard, like, him growing up knowing that I didn't want him.
Mm-hmm. Yeah. Yeah, not the lifestyle.
You know what I mean? Like, yeah.
Yeah. It's very normal. It's very normal to feel like that.
It is, you think?
Oh, definitely. Yes, yes. Many women don't want that. Don't want to bring someone into the world in that way, you know?
Mm-hmm.
It's very normal. But you feel safe in this procedure and in your decision?
It seems like I'm getting good answer. Like, it seems like you're explaining everything to me, so, I mean, is there anything where would not be safe for me?
This is actually a safe procedure. There's a lot of scary things on the internet. There's a lot of pro-life people who misconstrue things and don't necessarily get facts. They kind of just want to have an intimidating, scaring factor into women from getting it done. So
why is that?
Because they want to influence their beliefs on women, and they'll use that through fear or through. So yeah, there's a lot of skewed info.
Yeah.
On the other hand, there's also risks with any procedure, which you've read or we have listed here, and we do go over again if you have any concerns, okay? There's also a lot of patients who are concerned about fertility.
Oh, yeah,
Once the procedure's done.
Oh, yeah, I forgot that. I was thinking that earlier. I totally forgot.
Which we do want to address and answer, okay? A lot of pro-life people do try to push that, if you have it done, you'll never be able to conceive again, which is absolutely
Is that true?
No. There are studies that show, there's lots of information out there that show there's no influence with fertility, okay? In fact, and kind of a thing I like to refer to is we do have repeat patients. So if obviously they didn't have a problem.
Oh, you have.
conceiving
Oh,
again.
I see what you're saying. People that come back for other abortions.
Abortions, yeah.
Okay.
So, another way I like to explain it physiologically is we don't affect anything. The way you would really have concerns with fertility, you have a higher chance when you have a C-section of affecting fertility, okay? And that's because you're actually penetrating the uterus to get the pregnancy out, and you leave scar tissue on the uterus from the C-section, okay?
Oh, okay.
That could cause a defect in, like, fertilization, or when the embryo kind of embeds in the lining of the uterus. So the way, and I mean, I never knew this until I studied and understood it. When there's a conception, the egg and the sperm come together. It usually conceives up here in the fallopian tube, then moves down into the uterus and embeds there, and that's how it gets like the bloodline and support to live off of the mother, pretty much, and develop. Okay.
Okay.
If that embedding doesn't happen, then it's like a miscarriage. It just gets taken out when you have your period, you know, which happens more often than not. Actually, only about 20% of fertilized eggs survive to be live births. So actually, yeah, I didn't believe that either, but it's in all the pregnancy books, and anytime you look up miscarriages, that's the 25 or 25% are the only ones that survive. So
you said like when does it start developing?
So
this is interesting.
Yeah, it is super interesting. When there's conception, the sperm move up into the fallopian tube where the egg is, ideally. Sometimes the egg's already down in the uterus, and that's when when they unite and it conceives. Okay. Over a period of a couple days or so, it embeds in the lining of the uterus, and then if it's a successful embedding, that's when it starts the zygote. You know, the cells are multiplying, it begins developing into a zygote, and that's how the pregnancy begins. Yeah.
So that's when it really begins. Okay.
It needs to embed in the lining of the uterus to survive. Okay. Sometimes what's called an ectopic pregnancy is when it's
I've heard of that before.
Outside of the uterus, so in a fallopian tube, or somehow it gets all the way, you don't see the end of the fallopian tube, somehow it gets embedded outside of the uterus. There's just crazy situations that can happen, and that would be an ectopic pregnancy, and it would not survive outside. It can't grow and survive.
Seems like it takes a lot to actually happen.
Yeah, but surprisingly, it happens sometimes. Very rare, but it does. And that's when it would be a threat to the mother's life. Okay. That's where I'm coming back to the fertility. If the embryo was to embed like on scar tissue, that's where it would be more of a fertility type issue, okay? Because it doesn't necessarily always have a successful embedding, or it could cause bleeding because the scar tissue is not always safe in pregnancy. But that's very like low case scenario. You know, there's still plenty of women who've had multiple C-sections and they still have successful pregnancies, okay? So these are just very like worst case scenario type things. The only other thing we'd have to affect would be the fallopian tubes and ovaries to affect fertilization, okay, which we don't even touch at all. The whole process of an abortion, whether it's early or late term, is we're simply cleaning out the uterus of the pregnancy. Lining, like any kind of menstrual cycle develops during a menstrual cycle, and when you have your period, it all gets flushed out with blood. The uterus bleeds to get it all out and prepare.
Is that that's what the blood is when you have your period?
Yeah, and if there's any little clots or anything, it's the lining of the uterus that's coming out, okay, and flushing it out. All right.
Oh, okay.
So we're in a sense, a kind of, for more advanced, in a more extreme sense, manipulating the cycle of cleaning out the uterus. We don't use anything sharp or blunt. Even in earlies, the pregnancy is removed with the gentle suction. Okay? We're not cutting you or anything. We're not causing any scarring. Nothing like that.
Oh, gotcha. So there's no risk of like scar tissue.
Yeah. There is bleeding after, but that's the process of the uterus to get back to its natural cycle. There's bleeding after any pregnancy, after a live birth, after a miscarriage. That's how the uterus works. It gets what's in there out through bleeding. Okay.
Okay.
In the advanced cases, we are doing some manipulation of getting the pregnancy out with causing the uterus to start contracting, giving medicine that starts getting the lining of the uterus to detach to begin that flushing out process, okay? It is a bigger pregnancy, so there is more, that's why we need to induce the dilation. But we're not doing anything to cause damage to the reproductive system, okay? And that's where fertility would come into effect.
Gotcha. So there's no risk of fertility with this. Okay.
No, unless worst case scenario, there were like you were punctured somehow. We don't use anything to really puncture you, so there's not a lot of risk, or tearing or something. But I don't see it happening. You hear of with women who are giving birth that they tear, and that's when the fetus has already gained all of its weight. It's already developed to the full gestational age of 30 to 40 weeks. And the doctors don't go usually past, on average, they usually don't go past 30.
Okay.
Sometimes if there's a fetal indication and the baby has stopped growing and progressing and it's still relatively small, then the doctor may okay, as long as the woman's health history is safe, to have the procedure. Otherwise,
to have like an abortion after 30 weeks?
Yeah, that's when it's very red flag. The doctor always has to analyze and consider every, probably from 25 weeks up.
Gotcha.
Maybe 22 weeks up. The doctor analyzes each individual case and okays.
Because it's so developed.
Okay. And just to make sure it's a safe procedure. It typically is up to 30 weeks, but 30 and higher, it's definitely a case by case. She's carefully paying very close attention to the medical history, past C-sections, any blood conditions, any history of hemorrhaging or bleeding after pregnancies, and that's when those things kind of come into play that would put the mother's life at risk. Okay. If it is a dangerous procedure, she will not do it.
Okay.
Someone's having a baby.
Okay.
But you've already gone past that step. Okay.
Okay.
And you're not even in like the flag zone. Okay. That's why we say it's still safe to reschedule for next week.
Okay. Oh, thank you, Susanna.
Yes.
Yeah, it does.
And,
okay.
I totally understand, because who really gets an extensive productive class?
You're very well educated.
Yes.
Well, you are.
It helps.
Did you have to go to school for all of this?
No, honestly. I got a degree in community health, like public health.
Oh.
And when the training here is extensive.
Oh,
and
really?
Obviously, it's vital.
Yeah.
For the patients.
Okay, so they train you like here, actually.
Yes.
Wow.
Yeah. And there's plenty of resources to do more training on your own here. So it helps you.
Yeah. And you have training in counseling. Is that what it?
I got the training here in counseling.
Okay.
Actually, it's very specific training, and we're on like a 6-month preliminary period of training.
Okay.
And we sit in on a lot of councils. We are always debriefed when we're training. How did it go? What would you have done? Very detailed, because it's a very extensive this and see, that's the niceness and uniqueness of this clinic. It's a private clinic, and the doctor's philosophy, Dr. Boyd, who opened the clinic, he also has one in Dallas. But the importance of the patient understanding the sympathy and empathy with the patient and what they're going through, and helping them get through the procedure. So unfortunately, you may not find care like this everywhere.
Sounds like a good thing I came here.
But, you know, if you're calm and you understand, and we answer and we address all your concerns, emotional, mental, physical, anything, societal, anything like that, or religious even. If we address what's important to you, you're going to have a better experience, and we can take care of you safer. So that's most definitely, safety is the priority.
Yeah.
And your concerns and feelings and everything are priority as well throughout this whole process. So. And
there has never been any unsafe issues.
No, we're not gonna lie to you. There have been medical transports if a patient is bleeding, where we have to transport you to an emergency.
Oh, okay.
I have not seen one since I've been here. I've been here since May of this year.
Oh, okay.
Or last year, I'm sorry.
Okay.
But there are rare cases, very less than 1% of it happening.
Oh, okay.
And it's usually when there are previous conditions, very numerous C-sections.
Oh, okay.
Things with concerns with the cervix, or already, pre-existing conditions.
Oh, okay.
That and that's why the doctor weighs. Is it a
like
safe procedure or not?
Okay.
To try to avoid that.
Yeah, because what happened to those women?
They've maybe had bleeding that couldn't be stopped.
Oh, okay.
And we don't necessarily have all the, we're not a hospital.
Okay.
So we don't have all the equipment to assess it. And it's her best interest to transport her down the street to the hospital.
Okay. Did the patient was she okay?
Yeah, they've all survived. Yeah.
Okay.
No deaths. Okay.
Okay.
But that's any kind of risk with any procedure. Sometimes you do not you don't know exactly what you're getting until you get there. With any patient, that's always a risk of every doctor, even if they're just a family practice doctor.
Oh, really?
Yeah, because even if you have like cancer or something, totally outside of what this is. How do you know until a doctor's actually seen?
Yeah.
You could go in for a physical exam and they're like,
I'm sorry, I'm gonna grab a tissue.
No, yeah, go ahead.
Thank you.
So,
and actually, can I have a cup of water?
Sure.
Or,
so, we
sorry.
are supposed to eat or drink if we're going to do, but you're going to reschedule, right?
Yeah.
So let's go ahead and I'll go get you water.
Thank you.
We'll let me see if they want me to continue assessing your medical history so that it's ready for when you come back. You don't need to go through the council again when you come back. If you'd like to and you have questions and stuff, you most certainly can. Okay. So let me just go check.
Okay.
And then we'll get you set up to meet with the doctor as well.
Perfect. Thank you, Susanna.
Sure. And then we'll get your catheter out as well.
Oh, good. Okay.
I'll be right back.
Oh my goodness. Oh my goodness. Dear God, help me. Oh, thank you.
Sure. So there's some water. If it's like
thank you.
Some crackers too.
Oh, thank you.
And then I'll get the.
Oh, thank you.
You're welcome. I'll get that out, and then we'll go ahead and finish with the medical history. So just so it's out of the way. And then we'll continue. We'll get like your paperwork out of the way and stuff. But let me take this out just so you're more comfortable.
Okay, thanks.
Sure. So sorry.
No, that's okay. That's okay. You got it. It's okay.
Okay. I know the tape can be the worst part. Okay. And just apply pressure for 30 seconds.
Oh, is it out? Mm-hmm. Oh, okay.
Okay, so just so I can get that out of the way. And will you be able to come back next Tuesday?
Next Tuesday, okay.
Yeah, because we usually, this week was an exception. We usually start on Tuesdays, not on Mondays. And probably the same around this, well, no, it'll be an afternoon.
Okay.
Appointment.
I'll just, when I leave, I'll talk with my friend and then call if that's a problem. I will.
It may be a little, that'll be good because there may be some wait before you meet the doctor. So, we have 2 doctors that switch on and off, and we have one who's here all the time. So you'll meet with Carmen, Dr. Landau.
Okay.
She's the one who's here all the time. But as far as the other doctor who you'll be working with, she is not here. Okay, so we'll just have you meet with the one who will be here, and then you won't. The one who poked her head in, she won't be here.
Oh, okay.
So you'll meet with that one next week.
Okay.
So let me see. This is your first pregnancy, correct?
Mm-hmm.
Okay. And then, let me see. Was there any type of contraceptive that we could answer any questions on, or that you were interested in?
No, thanks.
Okay. Have you used any, or would you use any, or would you?
Primary
care.
Yeah, I'm gonna figure that out after. Yeah.
Okay. Do you have any drug allergies?
Mm-mm.
Okay. Let me see. Any surgeries or hospitalizations?
I never had surgery.
Okay.
Mm-mm.
No, like wisdom teeth or tonsil removed or anything like that. Okay. Any hospitalizations for anything?
Mm-mm. Is this considered surgery?
It would.
Okay.
Yes, because the cleaning after the pregnancy.
Okay.
We do remove the placenta and then do a check and clean out your uterus of any lining.
Oh, okay.
Lining.
Okay.
Are you currently taking any medications, vitamins, recreational drugs, or?
No, I mean, I was taking a multivitamin, like, on and off, but...
No? Okay.
Yeah.
Any history, like, asthma, diabetes, or anything? You didn't write anything here, so...
Honestly, I'm easy. I don't have any history at all.
Nothing to worry about. Okay. Okay. So let me put them there. So
okay, I'm just grabbing the water.
Yeah, go ahead. We're going to go ahead and fill out the rest of the paperwork. That way it's ready when you come back, okay? So regarding the dilator, consent and the digoxin injection, did you have any questions that you were concerned about?
Well, those were like as I was reading it, the things I circled.
Oh, okay.
But we might have talked about it.
Okay, so let's go over them and just see if we've covered them or not, or if you need any further explanation. Failure to cause fetal demise. This is very unlikely. We will do an ultrasound to determine that the demise has occurred, and if it has not, a second injection. So what that means was so pretty much I need to explain also, like I said earlier, once you're giving sedation, so when we bring you back to the room for the laminary insertion, a nurse comes in and starts the sedation, the fentanyl and Versed, and that in and of itself could cause fetal demise if you were to change your mind. So if you had any thoughts of changing your mind, which happens. Doesn't bother us. We're not going to induce anything to you that you don't want done. And we would prefer, you know, that you make the decision before we bring you back into the room, before there's anything that could cause damage to the fetus. Okay. So those 2 medications can have effects on the fetus, okay? But the ultimate effect on the fetus is this digoxin injection, okay? We are purposely causing the heart to stop for the safety of the procedure, okay? Obviously would have effect on the fetus if you were to change your mind. So that is absolutely the point of no return, okay? And that's what it says, failure to cause fetal demise. That's what I was also telling you. We do the ultrasound the next day confirms that the heart rate has stopped. Okay. So we would give you confirmation. The failure to cause it would be, we would give an additional digoxin injection to further.
Gotcha.
Okay.
So what would happen to those women that, has there been, like, what if the woman got the shot and then changed her mind?
She has to commit to continuing with the abortion. Okay.
Yeah.
And that's what this consent is about.
Okay.
That you are committing to it. If you chose to change your mind, that you did so, I mean, technically you had already consented to it, but because, like I say, this clinic is very concerned emotional and mental health, your state, if you're not ready to do it, it's not like we're going to press charges against you and say, no, you have to have this now, whatever. That's fine. But in your best interest, in the fetus's best interest, that you change your mind before this happens. Because otherwise it does have detrimental effects. Like,
it could have like deformities and stuff?
And it would not survive.
It would not survive.
Even if the first injection didn't work, eventually it would cause either deformities or you know, the brain wouldn't function, or it would cause severe damage to the development of the fetus, okay? If not stop it at some point, okay? Just because it doesn't stop it in 24 hours doesn't mean it wouldn't over a longer period of time, okay? So that's what that says. We are purposely stopping the heart rate. If it does not work at the first injection, we will administer a second and confirm it, okay?
Okay.
The second one, early unexpected onset of labor, which may result in unexpected delivery outside the clinic. Any questions with that we didn't cover?
I think you told me about that. Okay. Yeah. I guess, and I'm thinking with the shot part, on the first day, could it happen to me tonight that I would start doing that? Or that went next
early
week,
onset?
I guess. Yeah.
So the early onset of labor would be more determined on your dilation of your cervix, okay? So, I would say if you were going into early labor, the laminaria could fall out. If one does, it's not a big deal, but you'll definitely feel like something moving down. If you're not feeling contractions, then you will feel pressure and feel a mass coming through the birth canal.
Okay.
So,
which is you mean the baby? Okay, okay.
Yeah. Your water may or may not break.
Okay.
And there's just a variation, and everyone's different, and all possibilities have happened.
Okay.
So, yes.
Gotcha.
And if you have any concerns or questions today, since you're not having anything done, it's not like
okay.
Nothing is going to happen.
Okay.
Okay? So just call if you have any concerns, okay?
Okay.
But we're not placing any laminaria. No sedation has been given. Pretty much you're just as good as when you walked in here today.
Okay.
Fetal maternal transfusion, where the blood from the fetus enters the woman's blood circulation through the placenta. I've never seen this happen. This would be a better question for the doctor, because I don't quite know how to explain it.
No, that's fine. That's fine.
Okay.
I actually probably can't stay like too long because I'm thinking I'm going to need something to eat. So,
yes, okay.
So
abdominal pain after injection typically resolves spontaneously with supportive treatment, and that's probably just due to the body recognizing the termination of the pregnancy.
Okay.
And trying to start the onset of labor.
Okay.
Okay. Or extraction of the pregnancy. Okay.
Okay.
So, does that kind of answer?
Mhm.
Does that kind of cover? Okay. So, go ahead for me and initial right there, and
Okay.
then fill in your name here.
Okay. I initialed there.
Yeah. So go ahead and initial on the side there where you made the circles just to show that we covered it.
Okay.
And then your name right here.
Okay.
Okay. And then here I need you to fill out a number, like a cell phone number you could be reached at.
Oh, okay. Okay. Let me give the same. Yeah, I have it in here. Let me give the same number that. Because this is a new phone,
Oh, okay.
and I don't want to give you my old one,
Oh, okay. That'd be great.
which would not be good. That would be bad.
That's okay.
Okay, perfect. It's the same one I have on the other form too, so
Okay.
it's the same number.
Yeah.
Okay.
Okay. And
Oh,
then,
okay.
go ahead and sign there. Yes.
Okay.
Thank you.
Yeah. Sure.
So, any other questions that you can think of at this moment? Okay. Like I said, even before you come back for your appointment, give us a call and we'll address them. This is the on-call sheet that I'm just going to copy the number that you wrote on here. So, let me see. When you come back next week and when you get a hotel and everything, you'll want to give us where you're staying, the hotel you're staying at, the room number.
Okay.
And I'm just, since this will probably be the same number as next week, I'm just going to copy it.
Okay.
Like I said, this is the on-call sheet that the on-call person will have, and we'll fill out your hotel and number so that they know how to get to you. Who's your friend who's going to be with you?
Is there a lot more papers?
No, there's two
Okay.
more.
Sorry, I'm just
There's
getting
two
like.
more, and then one statement I need to write.
Okay.
And then we're good. So this is the sedation information. Did you have any questions regarding the fentanyl or Versed or Valium? Okay. Or the risks or anything? Common thing we see is maybe women getting nauseous, which isn't a big concern.
Okay.
Any questions regarding this one? I saw you put Phil.
Yeah, that's what I was thinking. Yeah.
So did that help with the digoxin explanation? Okay. And like I said, if any other questions come up.
Yeah, and I can always clarify it with her too. Okay.
Any other things you'd like to go over? Okay. And if you want to go over them again next week, we most certainly can.
Okay.
Down here it just mentions if you have any concerns, call us. Even after the procedure regarding bleeding or anything, give us a call.
Okay.
So just initial here and there, and then you'll date and sign the first 2 lines. And if you're pressed for time, you can always meet with the doctor next week, but if you're real eager.
I think, it won't be too long, so I'll just.
Yeah, okay.
Maybe I'll just do that fast and then.
Yeah.
Me and my friend will go get lunch.
And I'm just going to put your. Okay.
That would be good.
Yeah. So lastly, all I need to do is write a statement that you're clear in your decision to terminate the pregnancy. You're aware of the risks and benefits and nobody forced you to come here today.
Okay.
As far as payment, it's all out of pocket?
Yeah.
Okay. Sometimes there's some statements that we need to include for insurance reasons.
Okay.
That I'm not going to include here. I'm just going to write that small verbatim.
Okay.
And you'll sign it.
Okay.
If you want me to change anything, I can.
Okay.
But I have to do it in front of you.
Okay.
So you see what I'm writing.
Gotcha.
And then after we're done and while you're going to meet with the doctor, I'm just going to include another note on this page that just says you will schedule for next week.
Okay. Perfect.
Because all the dates and stuff.
Okay.
go ahead and sign there.
Okay.
And move it over. And I guess I don't need blood pressure since we're not starting to.
Okay, good.
So let me go get the doctor. Any questions before I leave?
Perfect. No, can I just pee real quick?
Yeah.
Okay, thanks.
The restroom.
Okay, perfect.
Would you like some more water?
No, I think crackers might be good.
Okay.
Thank you.
And there's a restroom right there.
Okay, perfect. Thank you. Go ahead. Go ahead.
So I'm gonna have you wait in here. I'll get you some crackers.
Thanks, Susanna.
Do you want some more water?
Sure. Thank you.
Sure. No, you're fine. We also have coconut Sprite. Would you like a soda?
Sure. Yeah.
Which one?
Sprite.
Okay.
Thank you.
So I'll get you.
Okay.
I'll get you some crackers
Thank
and
you.
I'll get the doctor.
Okay. Thank you.
So if you'd like,
Thank you.
Would you like us to? Do you want to go ahead and come around the front and reschedule? We'll get that set up while you're waiting, and then you could wait with your friend outside, and then we'll call you back in here to meet with the doctor when she's done, because she's still doing. Or do you just want to meet with her when you come back?
No. Well, I wanted to meet with her today, but
Or you can see. I say
yeah. How long is it going to be? Like,
I'm not sure. At least it could be another 15 or 30 minutes.
oh, that's okay. I thought you meant like hours. No, that's okay. That's okay. I'll stay here. Yeah. Oh, that's plenty. Perfect. That's
I want to make sure.
yeah. Oh, thank you for checking. Yeah. Okay. Yeah.
11:15 on next Tuesday. Would that be okay?
I think so, yeah.
Okay, so I'm gonna start penciling you in for all that and get you a little card, appointment card.
That would be good. Okay.
Dr. Carmen.
Hi, Dr. Carmen. Nice to meet you too. Thanks for coming in.
Sorry, this has been kind of a wild day for you.
Yeah,
huh?
thank you for coming in.
No problem. I understand that before you make an appointment to come back, that it's good to have a better idea of what it is that's going to be going on.
Yeah, just I've never had surgery before, and just I wanted to.
Yeah.
You know.
So this is not really surgery. So everybody, you know, in the medical world, we talk about abortion as a surgery, but it's really not. I mean, we're not cutting anything. And that's what surgery is when you take a knife and you cut someone open. And we are not doing that. The only thing that we're doing is gently dilating the cervix. So gently opening up a natural body opening that knows how to open up, because that's how babies are born. So it's a natural process, and we're just kind of helping it along. Does that make sense to you?
Yeah.
Before I forget, this is your appointment card for next week.
Okay.
And I will be here. So.
Oh, okay.
Yes,
okay.
Yeah, so
oh, good.
There'll
Okay.
be a familiar face, and Susanna will be here.
Okay.
So.
She was great. Yeah.
Yeah. So that's good to know that you're coming back
she
to
was.
familiar
Yeah.
face.
Okay.
So you were not as far. You were further along than you had expected.
Yes.
So what happened? Did you take a pregnancy test at home, or?
Yeah.
And then what happened? When was that?
They keep asking me, and I can't remember. I'm sorry, I really can't remember exactly when it was.
Was it a few weeks ago? A few months ago?
More month, like maybe like 2 months, maybe.
Okay.
Yeah. And then it was just issues with not, you know, with the guy, basically. Yeah.
So it seemed like things were going to work out.
Yeah, and
it turned out that you didn't want to be tied to him for the rest of your life. That kind of situation.
Okay. Yeah.
So he knows about this pregnancy. And have you guys talked about this?
Yeah.
And
he doesn't want a baby either. So.
Okay. So he was in agreement with this decision, but it's not something that you really want him to be part of.
Yeah.
So much. Okay.
Yeah.
Is this somebody that you've been in a relationship with, or just?
Yeah, but we're not anymore.
Okay, this was kind of the test for the relationship.
Yeah.
Yeah. This didn't hold up.
And it's just so. Yeah.
So, but he's supportive, would you say, of this?
Yeah, he's supportive of this. Yeah.
Okay. So how had you gotten any ultrasounds before today, or how far along did you think you were?
I thought I was like around 20.
And so,
which I guess it's kind of the same, but I'm farther now.
Yeah. So let's just double check. So basically, what happens is that after 24 weeks, it's just not as safe to do the regular kind of abortion that we would if you were, say, 20 weeks.
Yeah.
That's safer to let your body do the work rather than us take out the pregnancy. You would have contractions and push out the pregnancy.
Okay. And that what's the difference with that? Like the 20 is it just the?
So at about 24, 25 weeks, the size of the pregnancy, it's just bigger.
Just big. Okay.
Yeah,
like how big is like?
So like 27 weeks, I would say probably about that big.
Oh, okay.
Yeah.
Okay.
So.
Gotcha.
Whereas at 20 weeks, we're talking about that big. You know, it's.
Yeah, I can understand it.
The work that your cervix has to do is just a little bit more.
Yeah. It's pretty big.
Yeah. Now, it's not this. I mean, this is a term baby.
Okay, gotcha.
Know, and those things come out too.
Yeah.
So it's a lot less.
Okay.
We're talking about less opening of your cervix.
Gotcha.
Less pushing, etc. But you're going to be going through labor.
Yeah.
Yeah, and having a delivery.
Wow.
It's going to be probably a shorter labor.
Okay.
And it's definitely safer. You know, the bigger the pregnancy, the more risks there are in delivery.
Oh, so this is actually safer than
having
a normal
a term baby. Yeah. So all of the risks that we always have to, that we always worry about, we don't want you to worry about because we worry about it.
Okay.
Which is mostly bleeding is the thing that we worry about because it happens after deliveries. You know, some amount of bleeding we're pretty comfortable with, and we have a lot of tools that we can use, you know, medicines and things that we can do to stop bleeding. And usually we have no problem with that. Every once in a while someone will have really heavy bleeding. And if we cannot safely and comfortably stop someone from bleeding here, we will send them to the hospital. You know, if somebody needs a blood transfusion or if they need something else done, we will send them to the hospital because our number one priority is keeping you safe. And very, 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 very rarely do we have to do that.
Okay.
Okay. And, you know, the situation where someone bled so heavily they would need a blood transfusion, even more rare. And the situation where somebody would bleed so heavily, and even in the hospital they couldn't stop them from bleeding, and they would have to remove their uterus. Extremely rare. That would really be the only complication that would cause you to not be able to have children in the future, right? No uterus, no babies.
Yeah.
That's how it works, right?
Right. Okay.
And this is extremely rare. And there are some risk factors. So there are some women where we look at them and we're like, ooh, you're a little riskier, and you're not one of those people.
Okay.
You haven't had 10 children. You haven't had 2 C-sections. So you are what we would consider to be pretty low risk for having those complications. But you know, it's a 0.000 something % risk, but it's there. And death. You know, you go get your teeth taken out. It's always, you know, every medication, it's always a risk. It's a very, very small risk. And it doesn't go away if you decide to keep the pregnancy. It just gets more, right? So the bigger the pregnancy, your risk of having a severe bleeding, surgery, or death, it's all higher than having this abortion.
So it's safer to have the abortion.
It is.
Okay.
It is. So, you know, we want to be honest in saying that, you know, this is a big deal. But choosing not to have it doesn't mean that you get rid of the risks.
Okay.
Okay.
Oh, so have you done this before with people my size? Okay.
Yeah, lots.
You have done it a lot. Okay.
Yeah.
Okay. Well, that's reassuring.
People come over from all over the country and all over the world to our clinic.
Oh,
because
wow.
in most places you cannot get an abortion after 24 weeks.
Yeah.
So we see a lot of people who are pretty late in their pregnancy.
Wow. Well, what do you have? Do you have other things here that you can do it? Like, what's the difference with, like, being able to do it here and not another place?
New Mexico has laws. They don't have a lot of the restrictions. Yeah.
Okay, gotcha.
And you live in Santa Fe. So, and you know that you're going to be staying at a hotel here, right?
Yeah, Susanna told me all of that.
Figure all that stuff out?
Yes.
Okay.
Yes. Okay. Okay.
So we're not sending you back to, you know, Illinois or something. That's good.
Yeah. Okay. So that's good. So you've done this before, and okay, good. So, and she pretty much went through the procedure with me. Good. So, and I mean, I guess I just, sometimes people feel better, like, hearing things from doctors. Like, no offense to her, but, like, sometimes it's just, like,
and you want to
I don't know why,
like,
but...
do I come in here with, like, a ski mask on?
Yeah, it's just, like, sometimes it's reassuring when it comes from a doctor. I don't know. But if you could just, like, quick, like, walk me through, or just quick, like...
Day 1.
Yeah.
We do the injection that stops the heartbeat of the fetus. Okay. And I don't know, have you been feeling any movement? Yeah. Most people within a few hours, they notice that there's no movement. On day 2, we're going to check and make sure that that worked. Okay? That's not something that we're going to let slip through the cracks. So day 1, we do the injection.
Okay.
And we slowly start to open your cervix. It's the natural opening, and we're just gently opening it a little bit more with what we call wands, basically something like this.
Yeah, that's what she was telling me.
It doesn't have any sharp point on it. We just kind of nudge it open. And release larger ones and larger ones until it's open just enough that we place those little dilators. You saw those? These guys.
Okay.
And these things, if you put this in a cup of water, it swells.
Yeah.
And that's what we want to do.
It's like a mini tampon.
Like a mini tampon.
Okay.
And so what happens is we put some of these into your cervix, and overnight, with the moisture that's in your body, they swell and they gently open your cervix a little bit more. On the second day, we take these out and we put new ones in. That's about it.
Okay.
And on the third day, we will usually induce labor. Okay, so that means that we would break your bag of waters if it hasn't broken in the process, right? And that doesn't hurt. There's no actual breaking that happens. We just let the fluid out.
Okay.
And we give you medicine in your mouth, so it's a little pill that you hold in your cheek, and some in your vein, in an IV, right, like an IV bag.
Okay.
And those medications start the contractions going until you get into labor, and then you push and the pregnancy comes out.
Okay.
Someone will be with you the entire time.
Okay.
You're never going to be alone.
Okay.
And it's going to be hard that last day.
Because it's like you're having a baby, basically.
Yeah. It's smaller.
It's smaller.
But it's still intense.
And then how does it come out?
Just comes right out of your cervix and out of your vagina.
Okay.
And we make sure that you don't see anything.
Okay. Yeah, I was gonna say, what do you do with it?
Yeah.
Like,
then we take care of it for you.
you take care of it. Okay.
Yeah. Then the placenta comes out, and
Okay.
that's easier because it's squishy.
Okay.
Yeah, and smaller. And then we take you back to the procedure room again, because usually the delivery is going to be in a different room. It's like just more comfortable room. We take you back to the procedure room, and we do what's called the D&C, where basically we just check the inside of your uterus and make sure that there's no little bits of placenta or anything that's stuck in there, because we don't want you to have heavy bleeding afterwards.
Yeah.
Most people have pretty moderate, like light to medium like period-y kind of bleeding for a while after.
Would there be like baby parts in there?
No.
Oh, okay.
It comes out all whole.
Oh,
Yeah.
it does. Okay.
Yeah. That's the difference, right? So those earlier pregnancies, we have to go in and pull out piece at a time, right, to come through that cervix that's not as open.
Okay.
In this case, we're opening your cervix just enough for it to come out all in one piece.
Okay, gotcha. Okay. Now, if it comes out in a whole one piece, what if it's like breathing or something?
Impossible, because we did an injection on that first day to make sure that would not happen. That is that would not be something that we would ever allow to happen.
Okay.
Okay.
Okay. So, because I'm thinking, what would I do? What do I do if that does?
It's not going to happen.
Okay.
Yeah.
Like,
this is an abortion clinic. We do not do live births ever.
Okay.
Okay.
Okay. See, because that's what I was thinking since I'm further along. Like, people saying.
Yes. Are you ready for me?
We are.
I'll be just a moment.
In 3.
Thank you, ma'am.
Okay, sorry. That, there have been failed procedures, and then the woman has to take it home, and it has like deformities and stuff.
That is not something that has ever happened here, and it will never happen here.
Okay.
That would be completely unacceptable for us.
Okay.
Yeah. Not going to happen. I promise.
Okay. So I don't even have to.
You don't even think about it.
Okay.
Just take that thought and put it away, because it's not something that could ever happen. We're really careful about that.
Okay.
Yeah.
Okay. And the same thing, like with the shot. How does the shot actually work? Like that you said.
It's a medication.
Okay.
That causes the heart to stop beating. Yeah.
Okay.
Yeah. So we do the injection on the first day, and it usually will take a few hours for it to work. So on the second day, when you come in for us to switch out the little dilator sticks, we check with the ultrasound and make sure that the heart is no longer beating.
Okay, so if the heart's not beating, then so the baby is dead. It's not alive.
Yeah.
Okay. Gotcha. I mean, is it like it's going through me? Is it going? Is the shot going in the baby, like in the head or something, or?
Well, it doesn't really matter where it goes. Actually.
It doesn't matter. Okay.
Yeah, any part, as long as it gets
any part.
Yeah.
Okay. Okay.
And sometimes people worry. Oh, do you think that would hurt? The
Yeah,
baby?
that's kind of what I was going to ask too.
Well, there are a couple things. One is that a fetus at this stage of development has very limited abilities to understand or feel in the way that you and I do. Right? Like any living thing, if you pinch, it will move away. That's a very primitive pain response. And that's about all that it has at this stage. But we're going to give you drugs in your IV that are going to make you feel kind of... And those drugs also pass to the fetus. So it's already... And then it's just, like any shot, you know, like a flu shot or a vaccine, really.
Just like a flu shot or vaccine.
Yeah,
okay.
Yeah, and it's not like you and I, where when we get a flu shot, we're kind of, ooh, not that experience of anxiety and suffering is not, it's not capable of.
Okay.
And so that, I think, helps us all to feel more comfortable with this.
Yeah, to know that it's not like,
not a thinking being in the same way that you and I are. Right?
Okay.
It takes a lot of life to get to be worried about stuff the way that we worry about stuff, right?
Gotcha.
So
then that will like, you know, stop the heart, kill it.
Absolutely.
Will I? Because now I can feel it moving. So will I feel it like moving around when it's dying?
Probably not. We'll just kind of, you'll just, you'll notice I haven't felt movement for a little while.
Okay.
Yeah.
Okay.
Yeah.
Gotcha. And then I'm going to go back home, or in the hotel.
Yeah.
Okay.
Yeah.
And then she said, you know, make sure, like, if I feel like I'm going into labor or something.
You're going to call us. Yeah.
To call you.
Yeah. And when you come back next week, we're going to go over it all again.
Okay.
Because it's a lot of information. So between now and when you come back, I want you to write down any questions you have so that we can make sure that we get all of them answered. But at any time you can ask us questions. We're really okay with that.
Okay, thank you.
No problem.
Yeah, because I mean, have you, like, what would I do? You know, I'm going into labor.
Yeah.
In the hotel.
Yeah. If you were going into labor, we would open up the clinic in the middle of the night for you. Yeah, and we would have you come in.
Oh, okay.
Yeah. We take very good care of our patients.
Okay.
You don't really have to worry about anything other than calling us.
Okay.
Okay?
Yeah, call you. Yeah, don't, like, worry about in the middle of the night calling emergency.
No, you would never do that, no. Because those firefighters are not going to be able to help you.
Yeah.
Not what you want in the middle of the night.
Okay. Yeah, because what would they do? Like,
they would freak out, and you would freak out, and you would end up at some ER where you don't want to be, where they can't help you. So that's not, you wouldn't want to do that. No. Yeah. You do not need 911, you need us.
Okay.
We're your one-stop shop.
Yeah, because they don't, I mean, do they understand, like, what do they do different there?
No, it would just be terrible. Because then you're going to explain, I'm having a 3rd trimester abortion, and they're, everybody, no.
Oh, and they try to, like, have you do things?
Who knows? Not something that, we don't want to find out what they would try to do.
We don't want to find, yeah.
That just would be weird and not. And it's just not what you need. You need us to take care of you because we know how to take care of women in this situation.
Yeah. Oh, okay. Yeah. And the same thing, like if it pops out when I'm at the hotel.
Exactly. If you felt like all of a sudden, if you're one of those lucky people that has no pain with contractions, and all of a sudden you're like, something's coming out, you sit on the toilet.
Okay.
And you call us. And you unlock the hotel room, and we come in and we take care of you.
Sit on the toilet and call you. Mm-hmm. Okay.
Do you think anybody might come with you?
Well, my friend.
Okay. That'll be good.
Would that be better?
It's nice. I mean, if you feel comfortable with it, it's nice to have somebody with you at night. You know?
Yeah, exactly. Because what would I do if, I mean, if I'm on the toilet and it pops out and it's in the toilet, what do I do?
You would just sit there and you would stay there.
Okay.
And you would not move until we come and get you.
Okay. I mean, I don't have to worry about, like, taking it out or anything?
You don't have to clean anything. You don't have to do anything.
Okay. You will do. Okay.
You take care of everything.
Okay.
Okay?
Okay.
So, and we're going to talk more.
Okay.
We're not going to just have you come in next week and then take you immediately back to the procedure room.
Yeah.
We'll talk some more.
Okay.
Okay?
Okay.
Good. Okay. And please write down questions. Because I can tell you're the kind of person that's going to have more questions.
Yeah, I'm just like that kind. I just want to know things.
You're a thinking creature. You have lots and lots of questions, and that's good.
Okay.
Okay.
Okay. All right. Well, thank you.
You're so welcome. Would you like me to walk you out to the waiting room, or do you want to?
Oh, that's okay. Actually, I'm gonna just call my friend and wait out there.
So go ahead and stay in here, and I'll have Susanna come and get you in a minute.
Oh, okay.
Okay. All
okay.
Right,
thank you.
You're very welcome. I will see you next week. Take care of yourself.
sorry. I left my
That's okay.
thing there. Is that okay?
Yeah,
okay.
don't worry about it.
Okay.
So, well, just meet me here at the window, and we just need to,
Okay. Is it snowing outside?
Yeah, I guess it starts snowing.
My goodness. Okay, how much is it going to be today?
Today, $135.
Okay. I do have that. I just don't have the 8,000.
Yeah.
Okay. Let me see. Okay, there's 100.
Okay.
Okay.
Thank you. There's your change. She's gonna put up a receipt for you right now.
Okay, okay.
Any questions or how'd it go?
Good. Yeah, she was nice.
Oh, good.
Yeah.
So yeah, we'll see you next week and all of your concerns.
All right, thank you.
Sure.
Oh, I just need the receipt. Okay.
Yeah, if you want, we can call you up.
Oh, for the receipt?
Yeah, she's just gonna.
Oh, okay. That's okay. I'll just
print
stay
your
here.
statement.
That's okay. I'll just stay here. Yeah.
We'll keep it in your chart and give it to you next week.
Oh no, I mean, I'll just.
Oh, you'll wait here?
Yeah,
Oh, sorry.
I think so.
Okay.
Yeah.
Okay, sorry. It's okay.
Oh, I'm just waiting for the receipt. Yeah.
Hi, we're turning the lines over for the afternoon. Excuse me, we'll be in a meeting. You can reach us through the private line if you need to. And then just fax, all the other costs. And my name is Cindy.
And I'm going to call my personal number after that?
Yes. Yes. Thank you.